is a peptic ulcer? A peptic ulcer is an open sore in the lining of your stomach or your small intestine. This happens when the protection layer of your stomach or the intestine is not strong enough to withstand the digestive juices. You may have no symptoms, or you may feel discomfort or burning pain. Peptic ulcer can also lead to internal bleeding, which sometimes means you'll be admitted to hospital and needing blood transfusions. Basically, you have two types of peptic ulcer disease. One is the ulcer in your stomach, which is called gastric ulcer, and the other one is an ulcer in your small intestine, sometimes called duodenal ulcer. So what are the causes of peptic ulcer disease? Ulcers form when digestive juices damage the walls of the stomach or the small intestines. If the mucus layer gets too thin or your stomach makes too much acid, your gut will feel it. The two major causes of peptic ulcer disease are, number one, a bacteria called Helicobacter, and number two, certain painkillers. Let's talk about Helicobacter pylori first. As many as half of us in the population may carry this bacteria. Most people infected with Helicobacter do not get ulcers, but in others, it can raise the amount of acid, break down the protection level in the stomach, and irritates the digestive tract. You get Helicobacter pylori from unclean water and unclean food. Helicobacter is also through the damage done in the stomach over a long period of time. It is also a cause of stomach cancer. The second major cause of peptic ulcer disease are a group of painkillers called the non-steroidal anti-inflammatory drugs, or NSAID. Good examples of NSAIDs are things like aspirin, ibuprofen, naproxen, etc. You see, the NSAID blocks your body from making a chemical that helps protect the stomach wall. So if you take too much of the NSAID, you are likely to get peptic ulceration. Worth mentioning is another painkiller which is commonly taken, paracetamol or Panadol, locally called. Panadol or paracetamol, they do not cause stomach ulcer. Smoking cigarettes and drinking alcohol also can make you more likely to get peptic ulceration. Contrary to popular beliefs, stress and spicy food do not cause peptic ulceration, but they can make existing ulcer or ulcer from other causes more serious and more painful and harder to treat. So what are the symptoms of peptic ulceration? A lot of people with peptic ulcers may not feel any symptoms, but when they do, usually they will feel a burning pain or discomfort in the upper part of their abdomen or their belly. You may also notice that you get hungry more easily between meals or at night, especially on an empty stomach. Other symptoms may include a bloated feeling, burping, lack of appetite or weight loss, nausea, that means the feeling of vomiting, blood in your stool, or even dark color stool, and vomiting. Like I said, small ulcer may not cause any symptoms, but if you notice any of these signs, please consult your doctors. So how do we diagnose peptic ulcers? When you go to your doctor will ask you for your symptoms, especially whether you take any NSAID, painkillers, or any other drugs, and of course your medical history. The doctors will also examine your belly for pain. A lot of the time it is enough for us to raise the suspicion that you may have peptic ulcer. The only way that we can be sure whether you have a peptic ulcer is to take a look. These days, we can take a look through what we call endoscopy. Endoscopy for the stomach is called gastroscopy. Gastroscopy basically means we insert a small, long tube with a camera at the end into your stomach through your mouth. Usually we do this under sedation. That means we put you to sleep for a short while. It takes about 5-10 minutes, and we can have a good look at the stomach to see not only for peptic ulcer, we can also test for the presence of the bacteria or any other pathology or illness that can be in your stomach. So how do we treat peptic ulcers? A lot of peptic ulcers, especially the smaller ones, heal on their own. But if you don't treat these ulcers properly, especially if you don't treat the Helicobacter infection, the ulcers tend to come back. So the first thrust of treatment in treating the peptic ulcer is to heal the ulcer first. Usually we give something to suppress the acid in the stomach to help the ulcers heal. Then if we have found Helicobacter in your stomach, we need to kill Helicobacter, or else the ulcer will come back. And if you're on regular, or if you need regular painkillers, we need to see whether we can substitute the painkillers for safer ones.